With the Delta variant now found in 132 countries and regions around the world, countries that previously eased its social activity restrictions are now forced to impose new lockdowns due to the fast spread of the highly transmissible variant. New restrictions have sparked huge protests, and countries are facing the economic impacts of the measures. For more on this, joining us tonight is Dr. Tiara Martias, a health systems researcher from Gajah Mada University. Good evening, Dr. Tiara.
Good evening.
Hi, Dr. Tiara. It seems that various reasons have made it impossible for us here in Indonesia to have a strict lockdown. How do we come to a solution that you think might work in terms of maintaining economic recovery, but also at the same time without jeopardizing public health?
Yeah, thank you for the question. I think from the public health perspective, we do need to lower the case number down. How do we do that is nonetheless is immunization and then restriction of the social mobility, of course. But we know in countries like in Indonesia, especially in Java and Bali, the high mobility means that we need to identify who cannot not be working from home, right? You and I, for example, would be one of the privileged ones to be able to work from home. But people who, for economic reasons and for other reasons, just can't afford to have a lockdown in place. So I think uh, the government needs to target these people either through bansos that is already in place, but also to reevaluate how much do they need to be able to afford for a lockdown. Is $30 per family per month, as we know, one of the bansos from Kemensos is currently now being implemented. Is it really enough for covering the loss of incomes in Indonesia and among the lowest of the economic in Indonesia, right? And also the ease of the restriction as we see right now. Um, is it really, based on evidence? Is it the epidemiological data really support easing the restriction? Or are we absolutely not doing an effective lockdown in the last 6 weeks, for example? You and I live in Jakarta, for instance. We know that maybe the large roads are being closed off, but people are still wandering around in streets and raiding small business, for example, the warung and stuff. It's not really effective. You're taking away the livelihood of these people without really subsidizing them to be able to live, and maintain their well-being.
So again, it's the logistical problem on how we are actually going about the enforcing the restrictions, as you mentioned before. So you said immunization restrictions and for governments to identify who cannot not work from home. And the budget, as you said, has been $30 per family per month. The question is whether it's enough or not. Aside from all the things that you mentioned, what other efforts do you think the government should do to mitigate the impact of restrictions should they choose to opt for complete lockdown in the future? And what are the immediate policies that must be taken to allow these people to survive during these so-called social activity restrictions that you were hoping would be enforced more thoroughly in the future?
Right. First of all, I think a complete lockdown, it has been tried out a few years back in Bali. I think it's based from Dr. Diki statement. And it cannot be done simply in Indonesia. You cannot not let people go out of the house because we just don't have the economic means. Unlike, for example, in Australia, where I live throughout 2020, they pay every person who lost their jobs around $2,000 just to make up for lost incomes. And I don't see that our fiscal capacity would be able to do that. But at least we can do a more equitable approach in terms of, like you said, targeting who's really being impacted by all these, right? And do we really need to provide tax exemption for large businesses? Maybe in the long term, yes. But currently, to slow down the rates of the infection, we really need to target people who just still wandering the streets. And that's because of economic reasons. And then the second part would be to immunize these people so they cannot stay at home, but at least they won't contract COVID. and then they won't spread the disease to family members, as we've seen now. And our health system capacity just cannot take it anymore, especially in Java Bali area. And maybe lastly is we also need to go beyond Java Bali area. There has been some news and coverage as well where vaccination are simply not available in areas like NTT, small districts. I'm not saying that we need to prioritize these districts because of the smaller number of cases, but let's not forget that these are two Indonesian citizens that are impacted by COVID as well.